I'm Dr. Robert Kerr, Chief of Neurosurgery at Huntington Hospital with Northwell Health. I'm very grateful for the opportunity to talk with you about this very important issue in women's health in particular, and appreciative of the Handler Hope Foundation's interest in women's health and breast cancer research.
Hi, I'm Heather Zinkin, and I'm the Chief of Radiation Medicine at Huntington Hospital. I treat a lot of women with breast cancer who, with the advances in therapies these days, have an excellent overall survival of over 90%. But unfortunately, we have a subset of women with HER2/neu positive disease who have a significantly increased risk of developing brain metastases.
Unfortunately, there's a large number of patients who develop breast cancer that also develop devastating disease progression, which involves the brain and the spinal cord. Approximately 30% of patients who have breast cancer diagnosis will develop brain metastasis at some point in their disease. Approximately 50% of patients with breast cancer ultimately pass away from the complications of brain metastasis.
Unfortunately, there's no current guidelines advocating for brain MRIs as screening tools in these women. And without guidelines, insurance companies will not pay for screening MRIs. And we know that early detection is really critical toward cure and improving survival. So we're looking to fund a study to take these women with HER2/neu positive breast cancer, screen them with MRIs in the hopes of finding these lesions earlier when they're highly curable and the treatment is much easier and better tolerated.
With an initial study looking at our own database, we will be able to provide the numbers in support of other smaller studies which clearly indicate that early detection and early treatment makes an enormous difference in outcome. This is already being proven in other cancer types such as lung cancer, prostate cancer, and melanoma. But as yet, definitive studies have not been done in this important area of breast cancer. In the second phase, based off our initial survey, we will extend this study through the entire power and network of Northwell Health, which will literally encompass thousands of patients. On the strength of the data which we will certainly achieve, we will then be able to transform the standards of cares, such as at the Society for Neuro-Oncology and the American Society for Clinical Oncology guidelines level. It is our intention that once a patient is diagnosed with breast cancer, she would immediately undergo surveillance of the central nervous system, including the brain and spinal axis, and following that would undergo strict annual surveillance to detect early brain metastatic progression. In addition, the third phase of the study will combine innovative, leading new technology in the area of liquid biopsy or molecular marker surveillance. Running concurrently with our studies looking at MRI surveillance, we would work with a company to test the available products to look at serum markers within a patient's blood, which may in fact be much more powerful and less invasive and less costly to determine disease progression. As clinicians, we clearly have a large volume of patients where we wish that we had known information and screened information when the disease was at a much earlier state, where we know we could have been more effective with treatment. This is the battle that we are fighting together, and with your support, we hope to change care and the standards of care and make the outcomes different than they are currently today.